Welcome to Lecto. Today we are going to discuss oxygen hemoglobin dissociation curve. Before we start the proper curve, we should know the basic functions of the hemoglobin and how hemoglobin transport oxygen from the lungs towards the body. So let's start. So as we know that the blood get oxygenated in the lungs, and after oxygenation the blood move towards the body through the heart. So in between the lungs and the body you will see the heart that actually pump the blood. So in that situation basically the oxygen is transported by the hemoglobin, and hemoglobin is actually a protein which is present in our red blood cell. So here is the situation that after oxygenation the blood move towards the heart. So this is the case. This is the whole process. And now if you see that this is the RBC, and in the RBC you will see the hemoglobin, and hemoglobin is composed of 4 globin chain, and each globin chain is consist of one heme group. So here is the situation that you will see the 2 alpha globin chain and 2 beta globin chain. These are basically the 4 globin chain of the hemoglobin, and you see that the each chain consists of the one heme group. So this is the situation. So now in that situation in the lungs you will see the hemoglobin get oxygenated. It means in the lungs the hemoglobin become loaded. So this is the loading of hemoglobin. So this is just like a truck in which in the truck we load some materials, just like we load oxygen in the hemoglobin. So in that situation we load 4 oxygen molecules in the hemoglobin. So this is the case. Now it will move from the lungs towards the heart, and after when the heart pump then the blood move towards the body. So this is another situation. So if you see that here are basically the 4 oxygen molecule that is loaded in the hemoglobin. So in that situation we see that, keep remember that hemoglobin is loaded by the oxygen, but some amount of oxygen also moves in the blood. So here randomly some amount of the oxygen move in the blood. So in that situation now if you see that this is basically the arterial system, this is basically the arterial system, and in this system you will see the oxygen pressure is 95 millimeter mercury. This is the partial pressure of oxygen in the artery. And if you see in that situation 95% hemoglobin is saturated. Saturated means how much amount of the oxygen is loaded in the hemoglobin. So in that situation this is the arterial system that supply blood from the heart towards the body, and in this system you will see the oxygen tension is the 90, or you can say oxygen pressure is 95 millimeter mercury in the arterial system. And in that situation the 95% you can say 95% hemoglobin is saturated. Now when the oxygen is supplied to the body, then what will happen? After supplying oxygen to the body, you can say that if you see here the oxygen is supplied to the body by the hemoglobin, and after that you will see there is no oxygen in that situation. There is no oxygen in the hemoglobin. Now now you will see that in the body the oxygen unloaded the hemoglobin. So in the lungs you see the oxygen is loaded in the hemoglobin, but in the body you see the oxygen is unloaded. So in that situation you will see there is no oxygen available to the hemoglobin, which is actually the deoxygenated state. And in that situation you see that this is the RBC, and this is the hemoglobin. Now this hemoglobin in this state is unstable. So in that situation, a substance which is present in the cytoplasm of the RBD 2,3-DPG diphosphoglycerate is actually the substance, or you can say metabolite, that is present in the cytoplasm. And this metabolite, actually you see that this is the 2 alpha and 2 beta. Now this substance 2,3-DPG combine, or you can say 2,3-DPG enter at the center of the 2 beta globin chain, and after that this hemoglobin molecule becomes stabilized, otherwise it is unstable. So now to become the hemoglobin stabilized, 2,3-DPG molecule add at the center of the 2 beta globin chain. Now this hemoglobin is stable. Now after that this blood enter into the heart, and after heart you will see heart pump this blood, and here you see, here this is actually the 2 alpha and 2 beta, and here is the loaded of the 2,3-DPG. In that situation you will see the blood move towards the lungs for the oxygenation. So this is the basic process, that how oxygen loaded in the lungs and how oxygen unloaded in the body. So this is basically the general overview of the hemoglobin. So next we will discuss the curve. So here you can see on the x-axis we take the partial pressure of the oxygen in millimeter mercury, and on the y-axis we take the saturation of the hemoglobin, how much hemoglobin is saturated. So in that situation you see 100, 0, 25, 50%, 75 and 100% saturation. Same here, 25 of partial pressure, 50 partial pressure, 75 and 100. So if you see if we see that at what pressure hemoglobin become 50% saturated, the question is at what partial pressure of oxygen hemoglobin is 50% saturated. So if we see here that at the starting point, here you see this is the curve, and if you see here that at the 50%, this is the 50% saturation, and at what pressure you will see at the 26.6 millimeter mercury partial pressure of oxygen, the hemoglobin will be 50% saturated. This is the case. Now if we move forward, so if we talk about the vein, so this is the arterial system, this is the venous system. In the vein we see the oxygen tension is 40 millimeter mercury, and in that situation how much hemoglobin will be saturated? In that situation you will see the hemoglobin is 70% saturated in that situation. So this is another important point. So keep remember that this in the body we see the oxygen is unloaded by the hemoglobin, but keep remember not all oxygen is unloaded. There is some amount of oxygen is still present to the hemoglobin. So this is the situation. Now if we see here that at the 40 millimeter mercury you will see the 70% hemoglobin will be saturated, and here is the case, and this case is for the venous system, veins. And if we talk about the artery, so if you see here is the situation. Now at the 95 millimeter mercury you will see the 95% saturation of the hemoglobin. So this is for the arterial system. So these are basically the two situations, and this is actually for the normal 50% situation. So this is the situation. At 26.6 millimeter mercury you see the 50% saturation, At the 40 millimeter mercury you see the 70% saturation, that is actually in the veins. At the 95 millimeter mercury you will see the 95% saturation. Okay, this is the case. Then it's mean the question is, can hemoglobin be 100% saturated? Yes, hemoglobin can be 100% saturated. In the lungs, actually, hemoglobin is 100% saturated. But before blood exit through the lungs, the hemoglobin saturation will decrease and move towards the 95%. So this is the case. It means some amount of oxygen unloaded in the lungs before the blood exit from the lungs. So this is the situation. So keep remember, hemoglobin can be 100% saturated. Okay. Now this is the situation. Now if we see, talk about the left curve and right curve. So if you see in some situation you see the right curve. So in that situation, in some situation you will see the right curve. So this is actually the right curve. Right curve, you will see the right curve in different situation. So when the 2,3-DPG rise, when the H positive increase, when the carbon dioxide increase, when these three substances increase, then the curve move toward the right side. How? As we know that there is a competition between these three substances versus oxygen. So now, and here if you see, this is the hemoglobin. Now there is a competition between these three substances and the oxygen. Only those substances will bind to the hemoglobin whose concentration is increase. So in that situation, if the 2,3-DPG increase, then you will see 2,3-DPG bind to the hemoglobin instead of oxygen. This is the case 1. If the H positive increase, then you will see H positive bind hemoglobin preferably instead of the oxygen. Okay. If the carbon dioxide concentration increase, keep remember carbon dioxide can also bind to the hemoglobin. So this is another situation. If the concentration of carbon dioxide increase, then carbon dioxide prefer to bind with the hemoglobin instead of oxygen. If we compare the normal curve with the right curve, so you see here in that situation, let's pause. This is the two situation. This is the two situation. And if we see that, let's suppose this is the 30% saturated. If you see here at 2 points, you will see the 2 points. Here are basically the 15%. Let's suppose I say that this is the 15 millimeter mercury. So hemoglobin in the normal situation at the 15 millimeter mercury, the hemoglobin is 30% saturated. Okay, this is the case. But in the right curve, for the 30% saturation of the hemoglobin, we require 30 millimeter oxygen partial pressure. So this is the case. So these are basically the two situations. This is for the normal, this is for the right curve. For the 30% saturation of the hemoglobin in the normal situation, we require 15 millimeter mercury pressure. Okay. For the 30% saturation of the hemoglobin in the right curve, we require the 30 millimeter mercury oxygen pressure. So these are basically, it's mean in the right curve we require the high oxygen. If the oxygen concentration is high, then the oxygen preferably bind to the hemoglobin instead of these three components. So this is the basic concept. Okay. Now if we see here at the left curve, in some situation you will see the left curve. This is actually the left curve. In left curve you will see that the 2,3-DPG and the H positive concentration decrease. Now there is another comparison between these two components and the oxygen. So here is the HB, hemoglobin. Now these two, the concentration of the 2,3-DPG and H positive is decreased compared to the oxygen. Now oxygen is preferably bind to the hemoglobin instead of these component. So obviously in that situation you will see the at the low pressure the oxygen is maximum saturated. So if we again do comparison, so here you can see in that situation. Same if we talk about the same case. This is the normal 30% and this is the left curve. So in that situation you will see here, let's suppose this is the 10. In that situation you will see for the 30% saturation of the hemoglobin you will see the 10 millimeter mercury oxygen pressure. And if we talk about the normal, for the 30% saturation we require the 15 millimeter mercury oxygen pressure. So in that situation, in the left curve, you will see at the low oxygen pressure, the amount of the saturation will be equal to the normal, which is actually in the high pressure. So this is the case. Now, these are basically these two different components. But if we talk about the right, in the right side, we see HbS, hemoglobin S. In that situation, we see here, this hemoglobin hates oxygen. So, oxygen is enemy of this hemoglobin. So, if you see here that this is the hemoglobin S which is actually present in the sickle cell anemia, and in that situation there are two possible situations can exist. Here is the oxygen. If the oxygen come close to the HbS, hemoglobin S, then what will happen? So in that situation actually they hate each other, and in that situation oxygen, the binding of the oxygen to the hemoglobin S is difficult. So difficulty, so binding is difficult. This is the one situation. Now if let's suppose the oxygen bind to this hemoglobin HbS, then what will happen? So in that situation you see the oxygen can easily separate from the HbS because they hate each other, and the HbS repel oxygen. So in that situation you will see the separation is easy. So it means binding is difficult to the HbS and separation is easy for the HbS from the oxygen. So these are basically the two situations. HbS bind oxygen with difficulty and separate the oxygen easily. So this is for the HbS. So in the HbS you also see the right curve. So this is the situation. So in the left curve here is another HbF, fetal hemoglobin. So if you see here, same case, but HbF love hemoglobin too much. So in that situation, again you will see the two situation. Here is the oxygen, here is the oxygen. Now you will see two possible situation can exist between the oxygen and the hemoglobin F. So in that situation you will see they love each other. Okay, so there is a love that exists between these two, HbF and the oxygen. Now if the oxygen come across to the HbF, then what will happen? So in that situation the oxygen bind to the HbF easily. So binding become easy between the oxygen and the HbF. This is the situation one. Okay, now let's suppose if you see here, then if the oxygen bind to the HbF, then the separation will be difficult because they love each other. So in that situation you will see the separation become difficult in that situation. So these are basically the two things. Now if you see the binding of the oxygen to the HbF is easy and the separation become difficult because they love each other. This is just opposite to HbF. In HbS you will see the HbS hates oxygen and HbF love oxygen. So these are basically the two situation. In HbS you will see the right curve, and in HbF you will see the left curve. So this is basically the hemoglobin oxygen dissociation curve. In what situation the oxygen get dissociated or separate from the hemoglobin. So this is all about the hemoglobin oxygen dissociation curve. If you have any question, then you must ask in the comment section. Thank you so much.